Marie, how are you?
I'm good. How are you?
Good. We're going to be looking at your eyes in a lot of detail. And if you don't mind, we're going to start with one of our better ways of looking at dry eye, called lip of view. If you'll have a seat on the chair right behind you. Charlotte is going to run this test, and we're going to shut the door.
So there's going to be a bright white light that you're going to see. Okay. Very good. And you should start to see an orange light in there. Perfect. And just keep looking right at that orange light. I'm just getting it set up here for you. And just blink as you normally would. It's opposite of all our other machines where you don't want to blink. This one you do. And just keep looking right at that light and blink normally. Perfect.
Marie, we're just reviewing the results of your test, and what this test shows is that first you did have a certain amount of leftover product in your eye from the treatment that you gave yourself last night and this morning. The sort of purple colors that you see in close to the inner corner of that right eye, this is the area that we're talking about, shows the kind of colors that we see when somebody puts an artificial product in their eye that would be something more like Vaseline-like products. That will linger there for a while, and so when we see it today, we're really kind of getting a little bit of a slight contamination of your tears from that earlier product. And then the tear that you put in today may also have its own little bit of other things in it. This is okay for today's purpose, but to know that on a future evaluation, we might ask you to not use the ointment before or the drops in the morning. And this is still okay because it gives us some very important information. Although we can't comment as much on the quality of your tear because it's been contaminated, we can tell a lot about how you make your tears. And one of those things has to do with the way that you blink. And when we follow the way that you blink, what we'll see is that you're what we can term a partial blinker. So what does that mean? Well, when we follow your blink, so here we are starting at your point where you're coming pretty far down, and we continue to follow it forward. So we see what you look like as you continue to blink. We're going to see that the lids don't make the strong contact. This is the point where they should be in full contact, and there's that much of your eyelid open where it allows evaporation of moisture from your eye. But more importantly, you're not making the contact that promotes the production or release of the oils from your eye. So you're putting all these artificial oils in because you're not making your own good oils. So that can have a lot to do with how we would treat and further, help you with this problem. The left eye, kind of the same story. We can see again here different places where there was that sort of partial blink. That one may have had just a little bit of contact. We're getting a lot of data here that shows that this eye probably had a little extra tear in it. Some of that might be from the tear you put in earlier. Some of it may be what we call reflex tearing, because when an eye gets excessively dry and irritated, it turns on the fire hose gland that floods the eye with water, and so then it kind of breaks up the tear film. We don't get to see it quite as well. So again, another chance next time where we might choose for you to not put the drop in the morning, but we can still see the blinks, and there is an indication of an additional degree of that partial blinking that we're talking about. We'll explain more about that as we finish your exam, but this is just the first step. We've got a lot more things to do. The printout that we just did will show the details of today's evaluation on this machine. We will be making additional recordings based on what we see here. This all becomes part of a large package of information that helps us to make the best recommendation about how you can take care of your eyes to make them less red and less irritated.
Less irritated.
Right. We're going to ask you to move over to this other chair, and then we're going to start the next phase of your evaluation. Okay, so we're getting ready to start your evaluation. We already have the lip of view information. Beginning now, we're going to look at the condition of your oil glands, and so I'm going to ask you to come and rest your chin into this little chin rest here. This can be adjusted, so I want you to be in a comfortable position. Bear with me while we get everything just right. Is this too high, too low? We're pretty good. Okay. Be looking with a special instrument that allows me to look at those glands and see how much oil they have and what condition that oil is in. First thing I'm going to do is reach with this little tiny rubber device up against the side of your eye that'll feel a little bit like this light touch, and then there'll be just a little bit more pressure. And as I press against those glands, I am looking to see what kind of oil comes out of the little openings to those glands. So hang in there, just a little bit more pressure, you're doing a good job. And I'm seeing a slightly red, irritated looking lid. I'm waiting about 10 to 15 seconds. I'm really not seeing any oil so far. So then we're going to come in a little bit more directly here. Bear with me, same idea. This is the central part of your lid. And the technique is the same, so you'll feel the same little bit of pressure here, pressing up against the lid. And as I press and hold that bit of pressure, I do see one gland that wants to do something but isn't doing much. I see some scarring of some of the glands and indicating that there has been, some inflammation over time. We know that's what causes the redness to what should be the white part of your eye. But really, if that's even one gland, it's very inactive at this time. It looks like you have very sensitive skin, the kind of skin that we find often tends to flush easily and cause a little more redness at times. Do you find that to be true, that your skin reacts to things easily?
At times.
At times. That tendency is something that we would term rosacea, just because of that rosy quality that can come when it reacts. And a lot of times we'll see that same kind of rosacea-like reaction in the lids. It just indicates sensitivity and the fact that your oil glands are really not working very well. And unfortunately, it looks like there's not much in the way of oil production here either. So right now I would tell you that you really don't have much in the way of any oil-producing glands that are able to easily dispense any oil into your tears, which is why you have to rely on other products so much, because you're just not making it. So that helps to understand why you're having so much trouble, but we also then may get a better idea about whether we can help to promote better oil from these glands. I do see a few glands that want to do something here. I would say maybe they're really not doing anything even with that much pressure, but they look like they would want to. So I think they are glands that we definitely can work on. There's a little bit less scarring. I think this may account for why this eye feels a little bit less irritated than its fellow right eye there. This thing we call Marx's line is the line where the inner layer of your lid meets the outer layer of your lid, and when there's been inflammation there, that inflammation throws up this little bit of debris on the margin of the lid that can clog some of those little pores and help to block the little channels that allow the little glands to get that oil to your eye. And we can actually clean that up a little bit and help with that. But again, I'm not seeing much of any oil production there. Look up towards the ceiling for me. So that concludes the meibomian gland expression part. What we're going to do now is look at the glands from another direction. What we're doing now is looking at those little glands in a way that helps me to see how much, if any, glands we have there. If I'm hurting or bothering too much, don't be afraid to tell me. There are some glands that have become very shortened, and there are some glands that look a little bit thicker than they might be, indicating a degree of blockage. But I do still see some glands in there, which is a good thing. Let's look at the other eye. Bear with me, more of the same. Here again, I do see glands. Sorry, am I hurting you? Okay. I know it's annoying. But, some of them are a little disjointed, and I can see why maybe they're not working their best. I'll have you gently close your eyes if you were sleeping, and keep your eye just gently closed like that. Keeping your eye gently closed, I'm just going to apply a little bit of that light right over the eyelid. And the good news is that you are clearly capable in sleeping of keeping your eye closed. This doesn't happen for everybody, so this is a good thing for you. and that's fine. Now I'm going to have you sit back and we're going to put some drops in. So we just put a drop of fluorescein in your eye. This is a yellow dye that will help to show areas of roughness on your eye. It has an anesthetic in it, so your eye will be a little bit numb. This is called rose bengal. It is a rosy red color. Don't be alarmed. It doesn't mean your eyes are bleeding or anything bad. Okay, if you look up just a little bit. This helps us to look even a little more at that surface. One drop is better at showing certain things, the other a little bit better at others. So when we put that drop in and then you dab your eye, it's going to look a little bit like Halloween. And we're going to evaluate how that stain works on the surface of your eye. So the first thing that we're looking at, if there's any stain, I'm going to hold that lid down a little bit, have you look up, and then look down. And the next, with this blue light, helps me to see if that yellow color is reacting in a way that would show us more of that stain. So far I'm not seeing any overt staining, which is a good thing. And we're going to look at your other eye. It means that you've been pretty good about keeping enough lubricant in your eye that it's not getting to the point where there's nothing on the surface that would make your eye very sore and even more red. That's because you are putting drops in like 6 or 8 times a day and using those ointments at bedtime. So what we're now looking at is the undersurface of your upper eyelid. And now I'm going to go to a brighter light that will help me to see that even a little bit more clearly. And looking with that light and a little bit more magnification. Sometimes when people have a lot of irritation and dryness, they will get something that looks almost like a callus on the undersurface of that upper lid. Unfortunately, I don't see any callusing there so far. So the next thing that we want to do is to gently do that little scraping that we talked about. So try and look up towards the ceiling. Go to a little bit lower magnification so I can see this even a little bit better. That's the way, just like that. So what we're doing is just gently scraping back and forth over that surface there. If I'm being too rough, just tell me. You don't have a lot of buildup there, but there is some. Now I'm going to have you sit back and we're going to put some drops in. And having had cataract surgery makes the eyes a little more sensitive, so you'll be more aware of it. You used a lot of drops during that time that, you know, were part of what we had to do to heal your eyes. They've healed beautifully, you have perfect vision, but some of the residue of having had that much contaminant of, you know, chemical products in your eye makes them a little more sensitive too. That's all behind you now. What we're dealing with now is more your own natural tendency to be irritated, and the fact that we have this dry weather and that your oil glands aren't working. So,
explanation.
Yeah. So what we need to do at this point is to get the glands working. And so what I'm going to ask my helpers to do is to come back and start that treatment for you.
Strap is just going to be a prepare cane, so it's just going to numb the eye to make it more comfortable for you.
Okay.
As you know, it's going to sting a little bit when it goes in. Yeah. Some fresh tissues for you. And go ahead, look right up for me. Sorry, my hands are cold. Good. And you can go ahead and wipe your eye and keep blinking.
If you might just want to put a drop in the next side as well, so that's not the same. Otherwise, sometimes
okay.
blinking will just take the activator out.
Okay, sure. Yeah. So we're going to do both eyes. There you go. So both eyes will feel kind of funny. Okay. All right, hon. You doing okay?
Yeah.
Okay. I'm just going to uncoil all this. Okay, Marie. So what you're going to do is you're actually going to look down into the opposite side for me, okay? And you're going to feel me gently pressing up and pulling up on your lid. And it's just going to be just like a little contact. Good. And gently pulling down. And close both eyes for me. Good. Wonderful. Does that feel okay? Does that feel okay?
Well, I probably wouldn't know.
Okay, but no discomfort, no pinching at all?
Hurt, no.
So you're going to feel it getting a little bit warm. Nothing that should be uncomfortable. Good. And it's still just warming up. And good. Still doing okay?
Mm-hmm.
All right, so you can just relax. You're going to feel this consistent pressure. All right, so did you hear that, Marie?
Yeah.
So, yeah, it doesn't get any warmer than it is right now.
I can feel it.
Yeah. It's kind of just like a really warm compress.
Mm-hmm.
Right, do you feel any pinching in the upper and lower lid a little bit? So you can watch it the whole time. Once it gets to 42.5, that's the warmest it's going to get throughout the entire test. For the first 2 minutes, the first minute it goes up to 3 psi, and then it adjusts. I'm sure you saw this, right? You saw this all in Boston already, yeah. So then just before it gets, we're going to tell her it's about to pulsate. So in the next few seconds, Marie, you're going to start to feel some pulsing, okay? Okay, you starting to feel that a little bit?
Yes, I can feel
Yeah. And still feeling okay?
it. Yeah.
Good. And you're going to feel those more frequent pulsations.
Mm-hmm.
And those are going to start in about the next 15 seconds.
I can feel it though.
Yeah. Nothing uncomfortable though?
No.
Okay, good. And there'll be another series of pulsations towards the end of the treatment as well.
Mm-hmm.
You still doing okay, Marie?
Yes.
Okay, hon. We are more than halfway through the treatment.
Oh, that's good.
Yeah.
Nice to feel that little vibration there, you know.
Yeah, it actually feels like it's doing something, right?
Yes,
With
right.
and with all that heat, yeah.
And I'd like to hear the update on your things too. So.
Yeah, absolutely. All sorts of fun, exciting new technology here. All right, so not too much longer. If you fall asleep, it's okay.
Oh, I'm not a sleeper.
No. I do have a lot of patients that fall asleep on me.
No kidding.
Yeah, we do that other Schirmer's test.
Gosh.
Yeah, it's usually the men. It's usually the older gentlemen.
You relax more.
Yeah, I think so. Marie, it's all done.
Good, thank you.
Yeah.
Gosh.
Yeah, so I'm going to take off this tape. I'll be as gentle as I can, but as you know, I'm sure, it can be a little bit sticky there. Okay? And I'm going to have you just look up and down for me. Good. And go ahead, look straight ahead. Okay? So we've done everything we need to today. If you have any questions or concerns whatsoever, you can give our office a call.
Okay.
Use the drops more frequently than maybe you even normally would for the first couple days, and then we'll see you back to check and see how well they.
to me.
Perfect. Very nice. All right.
Thank you.
Good, Marie.